KSMQ Health Connections. Local healthcare providers answering your medical questions. This week's topic, what's old is new again.
Good evening. Welcome to KSMQ Health Connections, where we connect you to some of the finest minds in the medical field. I'm Ken Stone. Thanks for tuning in. Tonight's topic is not about a disease or condition that afflicts millions of Americans, but it is about a type of treatment that could be used to treat a whole host of diseases and conditions, such as heart disease, diabetes, cancer, spinal cord injuries, severe burns. It's called regenerative medicine. Regenerative, as in regenerating life.
Oh, it's alive! It's alive! It's alive! It's alive!
When this dead hand moves, the monster created by a man they called mad is turned loose to strike terror into the hearts of men.
All right, it's almost Halloween. We couldn't help ourselves. We can joke about Frankenstein or bring in the mummy back to life, but regenerative medicine is going on right now at a number of medical centers around the country. The Mayo Clinic Center for Regenerative Medicine is one of them. And tonight, we're going to talk with Dr. Jay Smith, who's a professor of Physical Medicine and Rehabilitation at the center. Dr. Smith, thanks for coming in. There are so many interesting facets to this, and what we're hoping is that you'll join in with the conversation. What are the possibilities when it comes to treating diabetes, burn victims, people who suffer from a serious sports injury, a person on dialysis who's waiting for a kidney, someone who broke their back and is now paralyzed? All of this could be treated with regenerative medicine. Nathan Hauber is a registered nurse. He's just one of the RNs standing by to take your call or your email. Nathan works at Prairie River Home Care, and he is a graduate of Riverland Community College's nursing program right here in Austin. The phone number, 888-255-0121. Our email is healthconnections@ksmq.org. As I mentioned, organ transplants, just one area that could be helped by regenerative medicine. Every 10 minutes, another person is added to the transplant list in this country. That adds up to 50,000 new people a year. The problem is there are not near enough donors. The number of donors has more than doubled since 1991. You take a look at the green there, just under 7,000 people to more than 16,000 people. And many times a donor is providing more than one organ, and so the number of organs donated has more than doubled as well. That's the blue, almost 35,000 last year. But when you look at the demand for organs, the pink, since 1991, it's not just doubled, it's more than quadrupled. Almost 115,000 people needed transplants last year. There just weren't enough organs available. We're going to talk about that and a whole lot more in the next 30 minutes. Again, you can take part in the conversation. Give us a call or send us an email. Dr. Smith, you are a sports medicine specialist, so let's start there. So Frankenstein, the hand coming to life. When it comes to the muscle and the body, how close are we to that?
Well, we're making great strides every year with regenerative medicine for muscles and tendons. At this point, our primary treatment for these with regenerative medicine is to try to help the body heal itself, which is really what regenerative medicine is about, is trying to harness the body's natural ability to heal itself. That can go anywhere from helping someone with tendonitis to ultimately making a new tendon for somebody, but we're still a little bit away from making a new tendon for somebody.
Okay, so talk a little bit about the center itself. I mean, it's a center without walls, right? How does it actually work?
Yeah, so Mayo developed the Center for Regenerative Medicine really to harness all the capabilities of Mayo Clinic. We have many people who are doing regenerative medicine in their respective departments and divisions, and Mayo really wanted to organize that into a cohesive group so that Mayo could move forward with the overall agenda. So it's really an organizational structure. Instead of putting everyone in the same physical location, we're all working in our own separate locations, but together for a greater cause.
Now, you started as a sports medical specialist. What is it that was about regenerative medicine what pulled you into that?
Well, I mean, fascination with the human body. I think most people go into medicine, regardless of the discipline, because they're fascinated with the way the body works. Human body is the most complex machine that we know, or biologic machines. So part of natural healing, if someone sprains a ligament or pulls a muscle, is to try to get that muscle or ligament to be normal again. And regenerative medicine is really just trying to facilitate that.
So you're doing some research in addition to practicing. Talk a little bit about that. What's the research that you're doing?
So we have a couple of different trials, but probably the most, maybe one of the most interesting is we have a trial using stem cells to treat knee arthritis. So people who have knee arthritis that has been not responsive to the typical treatments, we have a trial that's FDA approved to inject stem cells into the knee to see if we can improve symptoms and potentially slow down the arthritis.
So a couple of things there. First of all, talk about the stem cells. Exactly what is a stem cell, and why do you use them?
Mm-hmm. So yeah, it's a very complex topic, but I'll simplify it. People have different definitions for stem cells, but basically stem cells are naturally occurring cells in our body that have the potential to become other cells, but also can secrete or release a variety of factors that help the body heal itself. So they're kind of like the body's innate healing cells. They can produce new tissue and they can inspire the body to build tissue.
So the way I understand it, you can take a stem cell, which is sort of like a blank slate, and turn it into a muscle cell or a nerve cell or a bone, something like that?
Correct. I mean, if you get the right stem cell and you give it the right stimulus, it'll change itself into a different type of tissue, correct.
Okay, so you were talking about we're trying to treat people who aren't being helped with arthritis treatments. What is it about the arthritis treatments that don't work? Why isn't it working?
At this time, like many of the diseases we encounter, we don't actually have a cure for arthritis. The only thing we can do for arthritis is to help the pain and the decreased function that comes with it. But the cartilage damage that occurs and causes the pain and the inflammation of arthritis, we actually have no current treatments that reverse that. So really, regenerative medicine is trying to get at can we slow down the cartilage damage, or can we rebuild cartilage to make a more normal joint? Many people consider the treatments we have for arthritis right now mainly palliative. They're all symptomatic. They don't really cure anything.
So can we?
I think we can. I think we will. We don't have the answer yet, but there's promising evidence right now from trials. Our trial's not done yet, so I can't say anything about our trial. But there have been similar trials in Europe that have demonstrated some promise for these stem cells.
So when you do a trial, I mean, do you have to have a minimum number of people? I mean, how does that work?
Yeah, it depends on what you're trying to study. Most of these trials are in their infancy, and they all have to be FDA approved because these stem cells are considered drugs by the FDA, so it's no different than developing a new drug. So most of the trials are in what we call phase 1, which is really looking at safety. So you only need a smaller, relatively small number of people, anywhere from 10 to 20 people in the trial, just to document side effects.
And these are people who are all in. I mean, they're patients who want to be helped, right?
Correct. Lots of enthusiasm for regenerative medicine.
Yeah. Okay. I believe we do have a question. Nathan, you have something for us?
We actually have two questions. We have a question from Ellen in Hayfield and John and Albert Lee. Ellen asks about type 1 diabetes and if there are any cures on the horizon in regenerative medicine for type 1 diabetes. And the other question has to do with repairing damaged heart muscle.
All right, so you're a sports medicine specialist, but you're part of the center. What can you tell us?
Yeah, so with diabetes, there are many different treatments that are being explored that fall under the umbrella of regenerative medicine, but suffice it to say that, that researchers are starting to use stem cells to generate the cells in the pancreas that produce insulin, which is deficient in the type 1 diabetics. So the goal there again is cure. Instead of injecting yourself with insulin, try to get the body to make its own insulin again. You can transplant cells into the pancreas, or you can get the body to make its own cells again. So it's close, but not quite there yet, but there's great promise for that.
Okay, and there was also a question about heart. Repairing, something like 500,000 people, I think, get a heart attack every year, something like that, and you want to repair the damage to the muscle?
Correct. So there are many trials now that are in the late phases that are injecting stem cells into the heart during a heart attack or shortly after a heart attack to try to minimize the muscle damage of the heart attack, which will ultimately lead to a better outcome. So there's great promise there as well. None of those are really in the clinics yet, but they're close. They're getting close.
When you say not in the clinics yet?
Yeah. That means, yeah, so many of these treatments are still in the research phase, so they're not readily available. So if you hit the emergency room with a heart attack, you're not going to get stem cells into your heart.
Yeah, doctor, I want some stem cells. Yeah, it's not going to work that way. But I believe we have another question, Nathan.
Yep, Bob from Hayfield called. He actually had another question about stem cells and had heard some controversy about them, wanted to know where you actually get stem cells from.
This used to be a huge issue, less so now, but take us through that.
Yeah, so stem cells can be obtained from a variety of tissues, and when you're developed, of course, all of us were initially two stem cells, a mom cell and a dad cell, and all of us came from those two cells. So those are really the original stem cells. As we developed, those cells multiplied and divided and became specialized, and they actually lose their potential to become other things. So the stem cells that are in your knee can't really become all the other tissues that those initial cells could. So people were interested in embryonic stem cells because they were very powerful cells and they could manipulate them. But there were problems with that, both ethically, and sometimes those cells decided that they wanted to become tumors, and that wasn't a good thing either. To answer the question about where you get them, you can get the two most common sources of stem cells in adults are fat and bone marrow. Your bone marrow, where all your blood cells come from, also has a high reservoir of stem cells, and your fat actually has more stem cells, believe it or not, than your bone marrow does. So those are our two sources. For example, our stem cell trial for arthritis, we take a little piece of fat from the belly and we digest it and extract the stem cells and grow them before we inject them back into the knee.
All right. If you just joined us, this is KSMQ Health Connections, and we're talking about the next frontier in medical research and treatment, regenerative medicine, getting human cells to essentially fix the body. Our guest is Dr. Jay Smith. He specializes in regenerative medicine and sports medicine. Our phone number and email address are on the bottom of the screen for most of the show. Give us a call if you have any sort of question about regenerative medicine, how the body can essentially heal itself. We just saw a bunch of statistics there about diabetes and heart attacks. And so when there is research elsewhere in the center, somebody's researching, trying to make some breakthroughs in diabetes or heart, or does that affect your work in sports medicine? I mean, how interchangeable are the breakthroughs in one area versus the other?
That's a great question. That's one of the reasons the center was developed, is really to cross-fertilize between disciplines. There may be something that my colleagues that are researching diabetes and regenerative medicine, some technique or some discovery they have that could translate over into orthopedic indications. So it does have a lot of cross-fertilization, and that's one of the benefits of being at Mayo.
Talk a little bit about the promises that you see right now in the area that you're at. What's the toughest nut for you? What can't you fix? And what are you starting to see progress on, perhaps? Or
it's arthritis. I mean, osteoarthritis or just degenerative arthritis costs this country $185 billion a year. It's the largest cause of disability in individuals over the age of 60. And so it's a huge health problem. It's getting worse as we all live longer and we're all a little heavier, put wear and tear on our joints. So that's the biggest challenge right now, and that's why so much research is going into stem cells for knee arthritis.
It's sort of interesting because this kind of research is really expensive. And so the question is, how much money can you put into there? I mean, you know, are you going down a path that's so expensive no one can afford it, or is that, do you just go down there and figure it out later?
Yeah, we always have cost in mind, but we're not going to sacrifice the discovery for cost. And we certainly have many benefactors and sources of funding that we're very grateful for. But ultimately, we want to make these things affordable for the healthcare system. And there is cost savings on the back end. If you can actually cure or slow down the arthritis, then you can obviously keep people from having to get a knee replacement or hip replacement, and you save costs on the back end.
Nathan, did you have a question there? I saw you on the phone.
I do not have a question.
Okay, so I'll take it back. So who's your typical patient?
For in the clinic or for our
trials? I mean, for both.
Yeah. So, I mean, in the Sports Medicine Center where I do most of my clinical work, I can see anyone from age, 15 to 85 or 90 years old, depending on their level of activity. I'd say the most common patient we get when we're talking to someone about regenerative medicine is someone who's 35 to 75 who usually has arthritis in their knee or hip, or some sort of tendinitis that is not getting better, and they want to be active, they're healthy, they've been keeping their heart healthy, they've been keeping their lungs healthy, and now they got a bad knee or a bad foot and they want that fixed so they can do what they want to do.
So what do you tell them? I mean, when you're like, hey, come back in 5 years, we might have something for you.
Yeah, well, we do have certain treatments that are already in the clinic that are under the umbrella of regenerative medicine. So there are some FDA, what we'll say FDA compliant treatments. Platelet-rich plasma and bone marrow concentrate are two types of regenerative medicine treatments that we have been offering at Mayo for many years now that are under that umbrella of regenerative medicine.
So what do they do? What does the plasma do?
Yeah, platelet-rich plasma comes from your own bloodstream. We basically extract platelets out of your blood, and the platelets have a bunch of growth factors and anti-inflammatory chemicals. They're naturally occurring. They're kind of the first responder cells in your body. So by injecting them into tendons and joints, we can harness your body's natural ability to reduce inflammation and promote healing.
And the bone marrow?
Bone marrow is similar to platelet-rich plasma, but as I mentioned earlier, your bone marrow does have some stem cells in it. So it is one way to get some stem cells from one part of the body, that is your bone marrow, to another, is to take your bone marrow out, concentrate it, take a lot of the stuff that we don't want out of it, and then inject it into a knee for knee osteoarthritis, let's say.
I'm going to take you back a little bit. We've been talking about regenerative medicine, but apparently you break it into 3 different categories: rejuvenation, replacement, and regeneration. So talk us through the 3. How are they different?
Well, they're very similar. It's a variation of a theme. Rejuvenating is basically trying to make something younger again. I mean, we're aging, and the aging process is a type of degeneration if you think about it that way. So part of regenerative medicine is trying to reverse the effects of aging. And replacement obviously is transplant type of regenerative medicine, where you're trying to replace something that's broken with something that's new. And then of course the third type that we've been talking about is trying to take something that's injured and just make it better, make it new again.
So talk about some of the other things that's happening at the center. So spinal cord injuries. How can regenerative medicine help that? I mean, you break the back, you break those nerves. I mean,
yeah.
Where's the hope?
Well, the hope is that your body has trouble healing nerves, particularly when in the spinal cord, because that's kind of a protected area and it has very limited healing ability. So if you can kind of bolster it up and accelerate the healing by using stem cells or other factors, then you can maybe get the spinal cord to repair itself.
Are there different parts of the body which are harder to mimic? Like, is muscle harder than nerves, or nerves harder than muscle, or harder than bones? I mean, are there?
Yeah, the answer is yes. They're all different. It depends on how specialized the tissue. Typically, the more specialized the tissue, the harder it is to replicate.
Okay. I do believe we have a question. Nathan.
Yes, we do. Bill from Albert Lee called, and he has a question about strokes. Is there anything on the horizon to repair brain tissue?
There is research ongoing right now with regard to stroke, whereby stem cells are injected into the bloodstream so that they get to the brain to try to reduce the effects of stroke. Nothing that is imminently in the clinic as of this point in time, but there is research.
So when you take a look at all the different fields, where are we going to see the first wow? Is it going to be in sports medicine? Is it in transplants? Is it in the brain, or do we know yet?
I don't think we know. I think if you had that, there'd be a lot of investors that would be interested in that information. But yeah, I mean, there's a lot of research going on in many different areas, and we don't know where the big first hit is going to be. I'd like to think it's going to be sports medicine, but we don't know.
And I was about to say, other than arthritis, is there another area in your specialty that it's like, gee, I would really like to fix that?
Yeah, it's tendons. I mean, tendons, it's arthritis and tendons. So people have tendinitis, they have rotator cuff tendinitis. I mean, everyone knows someone whose rotator cuff is bad, those kind of issues.
All right. We have about 6-7 minutes to go. There is still time for you to give us a call with your question. Dr. Jay Smith is on the faculty at Mayo Center for Regenerative Medicine. Our number, 888-255-0121, and you can email us as well. Our address, healthconnections@ksmq.org. be bashful. Still time for you to call. Nathan, we actually have a question or two.
Two questions, actually. One caller called in and asked if there is an issue with rejection with stem cells the same way that you have rejections with other tissue transplants. And then we also have a call from Chris in Rochester who asked if there are any opportunities to be part of clinical trials for things like arthritis in knees.
All right, let's start off with the rejection question.
Yeah, it's a very good question. So one of the advantages of stem cells are that they're immunoprivileged, meaning because they're kind of native cells, they don't really express markers that would make your body recognize them as foreign. So you can actually take someone else's stem cells if they're cleaned a little bit and inject them into someone else, and there's very little rejection with the stem cells.
So unlike a lot of other therapies where it's really encouraged to take the cells from your own body, it doesn't matter.
Yeah, it doesn't matter if it's done correctly. And there are actually products already out on the market that are being researched right now that are what we call allogeneic, meaning they've come from someone else, stem cells that are coming from someone else.
Okay, and there was also that question about getting into a trial.
Yeah, there are many trials at Mayo Clinic. I would contact the Center for Regenerative Medicine. You could go to the Mayo Clinic website, www.mayoclinic.org, and search for the Center for Regenerative Medicine. They keep a list of all the trials that are ongoing.
In general, when somebody says, hey, I want to, doc, I got to get into this trial, talk us through how hard that is. I mean, what's the rejection rate? No pun intended.
Yeah, exactly. I mean, the biggest challenge is that most of these trials are trying to determine the safety of stem cells, and the FDA has their eye on this for good reasons, and you want to choose people that are healthy. The challenge is, of course, many times individuals as they're older are not so healthy. So the biggest rejection is that people's general health is just not up to par, meaning they have heart disease, they have other things that are not making them a trial. They might want to be in the knee arthritis trial, but they have bad heart disease.
So the people who are sick and who are like, doc, I really want to join in, they're not necessarily the best.
Yeah.
So you have to, this is almost like asking for blood donation. I mean, you're asking healthy people to, hey, help us out?
Correct. It's healthy people with isolated problems, a healthy person with knee arthritis, or a healthy person, if it's a heart trial, healthy person that just happens to have heart trouble but is otherwise healthy. So the most common reason someone gets rejected is because they're just too medically complex.
Okay, we got another viewer question. Nathan, what do you got for us?
Yes, Mary from Rochester called, and she has a question about macular degeneration of the dry type. Wondering if there are any regenerative medicine therapies on the horizon for that.
Yeah, there is some regenerative medicine therapies on the horizon, and they're not ready for prime time yet. But again, still looking at injecting various types of stem cells into the eye to help with macular degeneration. Has to be done very carefully. I'm sure that some of our listeners had heard about some individuals going blind after being injected into the eye with some quote regenerative interventions, but that's not the type of treatment we're talking about.
Let's talk about a couple of other things. Burn treatments. I understand there's a lot of promise, a lot of hope for that. What can you tell us?
Yeah, it's a little bit out of my wheelhouse. I don't know too much about the burn issue. Obviously, burn is a huge stress to the body, and regenerative medicine, obviously, the goal of regenerative medicine is to harness the body's potential to heal itself. So anything you can do to improve the body's ability to heal the burn metabolically will be effective. But yeah, I'm not sure that we're doing anything right now at Mayo with that.
And it's interesting because you would think the skin, that's got to be the easiest thing to fix, right?
Right. Yeah, I mean, skin grafts, in terms of making skin grafts or skin grafts that are more effective, certainly there's some promise there. But in terms of healing damaged tissue, I'm not sure that we're making very much progress yet.
We got about 2 minutes to go. Let's talk a little bit about organs. A lot of talk about kidney transplants, liver transplants, even heart transplants, and growing new organs. Where are we on that?
Yeah, that's very promising. We're already taking like 3D printing and printing what we'll say scaffolds, which are frames of ears and pieces of throats, and then coating them with stem cells and other tissues to try to make new organs with some help from the 3D printer. There are also individuals who are bona fide growing new pieces of the body, in the labs for people. I think that that's something that will come to fruition. I think that that's something that in our lifetimes we're going to see.
Which gets me to the last couple of questions. Take a look at where you were. When did you first join the Center for Regenerative Medicine?
Probably about 6 years ago. 6 years, yeah.
Where are we from 6 years ago. Have you been surprised by how fast or how slow it's gone?
Surprised by how fast. There's so much interest and the science is accelerating at such a great rate. I think that we have every reason to be enthusiastic about the breakthroughs, the potential breakthroughs. At the same time, we have to be cautious because we're still not at the point where a lot of these treatments can be available to patients because they just haven't been vetted well enough, but the promise is great cause for enthusiasm.
Take us 10 years from now. Where do you see us? Crystal ball time.
Yeah, I think we'll have off-the-shelf things that we'll be able to inject into people to heal damaged tendons. I think that we'll have agents to inject into knees and hips with arthritis to slow down the disease. I think we'll be growing organs for people. I think people will be banking their own stem cells and saving them for later in life when we get a little bit older to use them at that time.
All right.
Yeah.
Dr. J. Smith, thank you for
very
joining
much.
us.
Yeah,
Appreciate it so much. And our thanks also to Nathan Haubert and all the RNs here who have handled the phone calls and the emails. And I'd like to thank you for watching. Next week, we're going to talk about an illness that affects 1 out of 5 of us, and more than half the time, people don't get treated for it. Mental illness is our topic, and you can send in your thoughts or questions right now to our email, healthconnections@ksmq.org, or you can join our conversation live next Tuesday night by giving us a call. Hope you can join us then.